Okay, this is a guide as to how to use a port, and a port hasn't got any external parts. It's all underneath the skin. You can have a chest port or an arm port, and this is the port itself here. You can see from the diagram here that there's a few different parts to the port, and you've got the plastic or metal chamber, that's the whole thing. Then you have a silicone septum where you place your non-coring needle through, and then when you're accessing a port, this is the area where you need to aim for. This is the reservoir where you would get a blood return and be able to flush the fluid in through the catheter. So this is a central line usually where the catheter then will go to the superior vena cava. So it's accessed through the skin. And we're just going to do a few key things that you would need to do with the port. So I've cleaned the tray, we're using ANTT principles, washed my hands, and I need to find the right needle. Now there are different length needles. It has to be a non-coring needle. The depth of the port is dependent on what the length of the needle is. There are 19mm and 25mm available in Velindre, but there are others available. And as long as you can get the port needled to this reservoir, then that's the size that you need. Okay, so you can take blood from this port and you can use it for IV therapy as long as you get a blood return. That's one thing I would say: you would never use a port unless you get a blood return, because the danger is that you could pierce the skin and the needle isn't in the port here, it's outside into the chest wall. So this is the procedure. Open your needle. But at the moment, don't touch any of your key parts. Open your sterile gloves. So you'll need to have some saline to flush it, and you'll need to have some chloroprep to clean it. So after you've washed your hands, gel your hands at this stage and put on non-sterile gloves. So using ANTT principles, open your chloroprep, then clean the site. So clean for about 30 seconds around this area here. So feel where the port is, and then with your fingers, and then clean it. So clean it thoroughly for 30 seconds. And then once you've cleaned it for 30 seconds here, at the centre, you then just come around. And then you just let that dry. Now you need to prime your needle. So making sure that you don't touch the key parts, touch the very end of the extension line. And now that you've got your gloves open, this is a sterile area for you to be able to protect your key parts. So take your syringe cover off, and then the end of the port needle, and protect it in the gloves, and then you need to prime. Open the clamp, prime your needle, and then clamp. Make sure you don't touch the end so that you pop that back on. If you're going to use the port at all, you can put the bionectar onto the syringe now. Prime it, and then you can protect it in the paper. So, once this is dry, you then put on your sterile gloves, because you need to palpate. And I'll turn this page over before I do that. So, because you've got your sterile gloves on now, before touching anything else, you can now, once it's dry, palpate the area. Because you do have a specific port that they use. This is a CT port, and there are 3 little bumps on the septum. So you need to get your needle in the septum here, as you know, in the centre. And you can feel the 3 bumps, and that will denote that it's a CT port, and it also tells you where the centre is. So you feel for those lumps with your sterile gloves, or you can just feel for the surrounding port. And then you pick up your port, because you haven't touched this area, because so is ANTT principles. Pull your protective cover off, feel for the centre. Take your time to do this to make sure that you're right in that septum, and then pop your needle in. You should feel the plate. If you're not in the right place, or if your needle's too short, your needle's going to be in the septum, or it could be on the side of the catheter. So once you've done that, you need to get a blood return from it. As I prepared earlier. So you get your 10ml syringe and you get a blood return from it. So it's really important that you get a nice blood return. You don't really have to get too much of a blood return, but maybe about 2 or 3 ml just to get the heparin out of the catheter. So once you've done that, you need to flush it. So if you've got this prepared, if you're going to use it at this stage, if you just want to use it for blood withdrawal, blood sampling, you can put the end connector on and take your bloods. So then flush it after you've taken the bloods, if that's what you're going to do, and then clamp. So now, if you were going to just do a routine flush, you would flush it at this stage. If not, you need to secure it. If it's a day case and you're just using it just for a few hours, then this kind of dressing would be suitable. So what we found works a little bit better is 2 cannula dressings. So you've got those little strips that you can put on the side, and then a cannula dressing either side. And it's important, it's the purple bit underneath that you need to secure. It doesn't really matter about this bit when you're on a day case, so the patient's not going to be there for long. And then another one the other way, just to make sure that it's secure. So again, just the purple underneath that you're protecting. It's not going to be pretty. It's just securing that part so it doesn't move during the transfusion or the infusion. Okay, so if this patient is staying on the ward and you need the needle to stay in, these needles can stay in for 7 days. I would suggest that you take a blood return every time before using it. So you would do something like this. Put some gauze either side. It's a little tricky. And then on the top. And then always make sure that you put your extension line in between the gauze. And then put your Tegaden on the top. Basically what you're trying to do is making sure that it doesn't move. So you can take your time and make sure that that's stable. So make sure the clamp is outside so that somebody can use the clamp and it's not underneath the dressing. Okay, so once your infusion is complete, or you're just doing a routine flush, you need to de-access, so just take the needle out. So take all the dressings down. A little bit trickier on a plastic gun. So be careful when you're doing this because you don't want to dislodge the needle whilst you're taking the dressing off. Oops. So again, make sure you press down if you're taking any dressings off just to secure the needle in the chest until you're ready to flush it. Okay, so once you've taken the dressing off, you could now flush it. So non-sterile gloves are fine to flush it. Okay, so you get a syringe with saline and flush that through first. So, get rid of the air first. Obviously clean the end with the clinella and let it dry. And then flush with a good amount of saline after the infusion is finished. Then you need to lock it. And you need either heparin 100 units per mil, or if the line is being used in the day or within a week or 7 days, then you can use the heparin 10 units per mil. But if it's anything over a week, then it's the heparin 100 units per mil, and that's 5 mils of it. So if we just pretend that we've got 5 mils of that, obviously you'll need a filter needle to draw it up from the vial, because it's a glass vial. So to de-access a port needle, you've got your 5 mils of heparin. You've obviously cleaned the end and let it dry. You flush it, and this is how you do your positive pressure flush. You flush, and then as you come to the very end of the flush, you clamp, and then you can remove the needle. So to remove the needle, this can be done by one person. You just hold down to the purple. Make sure you do that, hold to the purple so that this is secure. And then with these safety needles, you need to pull and pull and pull until you can't pull any further, and that means that the needle has encased right into the device itself. There we are.